Welcome back to the Dr. Plucky Family Health Hour, AM 1220 KHDS, your hometown station. I'm your host, Dr. Thomas Plucky. Today's show has been about the controversy of cannabinoids, and CBDs have been around for 5,000 years. As early as 2737 BC, Emperor Shennong of the Chinese dynasty published a medical encyclopedia where he showed that the cannabinoids were used for constipation, gout, rheumatism, and of all things, absent-mindedness. So we're not talking about the sativa, we're talking about the sativa, not the indica, not the plant discovered in the 1750s in India, by French botanist Baptiste Lamarck, Jean-Baptiste Lamarck, who saw there was a big difference between the plant that is native to India and the plant that had been grown in Europe for centuries for industrial hemp. The flowering plant, indica, has a concentrate of THC, and that is the controversy in the marijuana world. So that is the psychoactive drug, the controlled substance, the stoner, the high in medical marijuana. Now there's over 100 other cannabinoids that have been studied and researched and documented for, as I said, 5,000 years, from the Chinese through the ancient Egyptians for treating cancer and tumors and epilepsy, through the Greeks. The ancient Greeks used it on their war horses. From battle wounds, a liniment made out of the cannabis plant. Saw the vets were using it to help the injured animals recover. Through Victorian Europe, up until 1940, through the 1900s, up until 1940, it was part of any doctor's bag, tinctures, extracts of the cannabis plant. In the United States, our founding fathers were all hemp growers, and the interesting thing is, around 1937 there were other interests involved as far as replacing the industrial use of hemp in this country with synthetics, with replacing the medicinal use of all of the cannabinoids with synthetic drugs, because up until then, it was part of the USP, the United States Pharmacopoeia. It was, which is a list that's published every year of known medicinal value for these drugs. Now that all had to go away to be replaced with all the synthetic drugs that we currently know for things like headaches and aches and pains and digestive problems and sleeping problems and mood problems. All of those things had to disappear from the USP right around 1941 in order to make way for all of these other synthetic pharmaceuticals that have now dominated for the past 80 years, give or take. So the interesting thing is, legally there's a shift taking place where marijuana is now starting to be recognized for the medicinal value. In the 70s, it was claimed, it was categorized as a Schedule I substance that has no medicinal value, and yet 5,000 years say otherwise. So all of that is going by the wayside, probably going to happen at the end of this year, and it's going to start opening up a lot. Unfortunately, with the good comes the bad. We're going to have legislation for recreational use, and there are going to be problems involved with that. One of the main problems that most people don't foresee is it's got the big corporations involved now. And you're going to see a lot of quality control issues that, when Monsanto inserts their genetic code into marijuana and people are ingesting it in ways, who knows what that's all going to have. I'm old enough to remember in the 70s and 80s what happened when paraquat, a herbicide, was used. Now they want to inject their Roundup resistant genetic code into marijuana, and people are going to be ingesting that in ways that were probably never intended, like smoking it. I'm not a fan of recreational use to begin with. I am a fan of getting government out of the marijuana restriction. However, there are going to be some sticky obstacles to navigate through. In the meantime, however, CBD does not require a prescription. It is available, and it is the whole raw plant extract that we carry in our office as our guest, Dr. Cass Ingram, one of the world's renowned herbal medicine specialists. CBD has been documented for aches and pains and digestion and seizure and mood problems as well, and we're seeing all of that happen when used in combination with the no twist, no crack chiropractic kind of practice that we have. You're welcome to contact the office by phone 661-753-9340 to have a complimentary consultation to see if this is the answer you've been looking for. You've been listening to the Dr. Pawlowski Family Health Hour, AM 1220 KHTS, your hometown station. Up next is Carrie Quasham with Families in Action.